I'm Dr. Brian Nickel, your cannabis expert for CannabisExpertMD.com. We're out in the woods again this weekend. We had the opportunity to spend some time at my parents' place with my sister who's back in town from Miami, Dr. Lisa Tyler, my favorite sister and colleague. We're going to talk a little bit with her about her experience with the forest bathing she had last time she was in Arkansas and how things have been since she's been in Miami. Now, Lisa, you've been back into Arkansas for just several days now. Last time we talked with you, we were remarking about how much better you felt overall after spending some time in the forest out here. How have you felt since you've been back?
I felt very, very good. More energy, better sleep, been able to do more, no anxiety. It's been a very good experience.
And last time you were here too, I know when you went back to Miami, did you find the health benefits, the good feelings, did they persist for a while?
They persisted for about 2 or 3 weeks and then very slowly trailed off to where the anxiety got to me again. But, you know,
And what kind of trees do you have in Miami area down there
well,
pretty
we,
much?
we, you know, we do have some hardwoods, but not nearly as many hardwoods, more palm trees.
Or palm trees?
Than obviously in Arkansas. You can find forest, but you've got to look for it. My neighborhood is mostly palm trees, so I don't get a whole lot of benefit. And then it's hard to take time to go out and purposely seek out a forest, for me anyway.
So in the last several days, we've been doing quite a bit of work around the parents' place, clearing out some of the underbrush and doing some burning. As always, you know, we're getting a bit older here. I know both of us had a few aches and pains. I know normally you do take CBD and CBG products to control your symptoms. We did talk a little bit, and you've kind of changed a little bit of your dosage. Have you found that that has improved some of the symptoms you were experiencing just from a little bit of hard work?
Yes, definitely. I've noticed that the pain goes away. I felt like I had a catch in my hip since increased my dosage. I noticed that the pain has decreased by about 50% and my mobility feels better.
I know you're having some of that muscle pain too, and we tried that Chillax Terpinair. Did that seem to help with the muscle pain like I thought it might?
Yes,
Well,
yes. I was very pleased with that result.
well, thanks for the feedback on that. I'm always looking for lab bunnies to help me determine things, that's for sure. Now, Lisa, you are a transfusion medicine physician. Now, a lot of the patients are probably not familiar with this particular specialty. You're more of a doctor to the doctors. When I was doing anesthesia and having issues with patients that needed massive transfusions, you were the kind of doctors I called for advice. But why don't you just kind of let some of our audience know exactly what that particular specialty does?
Thank you for the opportunity. There are actually two parts of transfusion medicine. The first one is dealing with donors, making sure that a donor is eligible to donate, and the other part, and that the donation is safe and that the product is safe. The other part is the actual transfusion in the hospital, getting it to the patient. And if the patient has difficulties or massive transfusion, different things like that. I've dealt with both aspects, and currently I'm on the hospital transfusion side.
Well, that becomes more and more important as people are undergoing organ transplants and the advanced
Yes.
cancer treatments, including bone marrow transplants. The whole idea of people having allergic reactions to different blood types and the antibodies becomes very, very critical for people like you to step in and be able to guide us practicing physicians on the patients in the proper use of these products. These products do save a lot of lives, Lisa. Now, are they produced synthetically?
Absolutely not. The only place we can get red cells for carrying oxygen or plasma with clotting factors or platelets that help form clots is from donors. Now, COVID-19 had a huge effect on our donor pool, and we are always short on blood, but the shortage became far more severe. A lot of people didn't come back to donate after COVID came. And so we are always in desperate need of donors. And I would like to encourage your audience to please consider donating blood.
One of the things that I have heard from patients, a question that comes up occasionally is, I'm a medical cannabis patient or I'm just a recreational user of cannabis. Does that exclude them from donating blood?
It does not. They do not test for THC. The collection facilities do not test for THC. However, you cannot go in impaired to donate. If you show any sign of being impaired, if you've had too much to drink, or if you are under the influence of any medication and you can't give good consent, you will be rejected. But that is the only problem, or the only limit to someone using medical cannabis or recreationally donating.
So somebody that is using cannabis donates blood, their blood won't hurt another person that receives it, and won't make them high or cause them to test positive for THC or nothing like that. No concerns with that.
No concerns with that at all, no.
Well, I sure hope everybody goes out there and does donate blood. It saves a lot of lives, and there's a tremendous need for it.
Always a need, yes.
Well, Lisa, I look forward to talking to you again as far as your experience with terpenes, and as you start to experience the improvements in your life using cannabinoids and terpenes to improve the quality of your life. We're going to keep following you and see how all of that works.
Happy to do it.
For more information on all things medical cannabis, be sure to check us out at CannabisExpertMD.com. We're also available on YouTube, Instagram, Facebook, Twitter, Gab, and the relevant application under Cannabis Expert MD.